Hi, I'm Chenkai Wang from University of Illinois Urbana-Champaign. Today, I'm excited to share with you the design of VeriSMS, a message verification system for inclusive patient outreach against phishing attacks, and our finding throughout the design process. Patient outreach is critical nowadays. Healthcare providers enable many channels like text messages, email, mobile apps, web portal to ensure timely communication, which further allows better patient education, appointment and follow-up schedule, management of chronic disease and preventive care, as well as medication adherence. However, criminals often target patient outreach for phishing because patients rely on those critical functions. According to fraud reports from Federal Trade Commission, in 2022, more than 68,000 cases of healthcare fraud occurred, with a total loss of over $17 million. The phishing threat is serious because, first, it cannot be reliably detected based on the message content. As shown in this example, criminals may easily mimic the tone or use content that is identical to messages from healthcare providers. Moreover, patients may be vulnerable to phone number spoofing, which means checking sender's phone number is not reliable as well. Of course, modern channels like mobile apps and web portals can utilize proven security features to secure patient outreach, but unfortunately, it may not be available to everyone. Especially many of those have varied needs to patient outreach. Researchers found that in 2022, only 61% of older adults in the United States owns a smartphone. Also, patients with low socioeconomic status may not afford a capable device. Our colleague from OSF Healthcare brought up that SMS is the most inclusive channel to their patients, which is available to every cell phone, including basic feature phones. So, can we protect SMS from phishing for patient outreach? With some exploration, we came up with the key idea of VeriSMS, that is to make messages verifiable by receiving patients before they react. We start to look for options that enable users to verify each message received are actually from healthcare provider they use and do not solely rely on sender's phone number. Also, with such a system, patients should also eliminate the need to distinguish phishing messages based on its content, for example, wording or an URL embedded. Well, that can be easy. The most naive approach is to just embed a pre-shared secret code for all messages to a patient that is only known by the receiving patient. For example, this patient knows the correct secret word is Apple for them. The hospital now embeds Apple in every message sent to this patient. When the patient sees Apple in the message, it identifies the message as from the hospital, therefore trusts it and reacts to it. But what if the secret code is leaked or guessed by a criminal and use it in phishing messages? The patient who rely on the secret code may never realize until it's too late. What's worse, even if they find content is suspicious, they lack ways to double-check its authenticity. So, we reckon this approach is insecure. We need a better system. We then shaped the second approach named after one-time code. In this approach, each message now contains a pair of random code. One is message ID, the other is secret. This approach incorporates a voice agent system hosted on a trusted phone number. The number is printed on patient's physical hospital card, serving as a root of trust. By design, for a patient to verify if the message is from their hospital, all they need is to call the voice agent and enter message ID. Voice agent should read back user secret code on that message if it's an authentic message from the hospital. Again, let's look at the example. The random message ID is 13579 and the corresponding secret is 24680. Upon receiving the message, the patient calls the voice agent, enter 13579. The voice agent should read back 24680 to the patient so that patient can compare if that matches the text message they received. As they match, the patient can determine the message is verified and continue to react. This seems well thought for security. However, it is another story if user does not call. As a pair of codes are random for every message, themselves gives no heuristics to patients for verifying the message. Will user always call to verify the messages? Finally, we introduce our VeriSMS design, which takes the best part of the two naive approaches. For VeriSMS, we kept the message ID and voice agent from the one-time code design. The secret is now a word combination chosen by the user. The word combination will be fixed and appear in all messages unless user elect to change. In the example message, the word combination is chosen to be Apple Moon by the user. With this change, VeriSMS allows a balance between security and usability. The patient receiving messages do not have to call every time, yet still get a recognizable secret. When they believe the message is important or suspicious and want to double-check before react, they can always call the voice agent. Suppose patient receiving this message wants to thoroughly verify. They would call the voice agent and enter the message ID. Voice agent will confirm that message with ID 13579 was authentic patient outreach message and reply Apple Moon is the corresponding secret. Then the user may continue to trust the message and react. With working principle of VeriSMS explained, let's see if it may effectively mitigate the phishing threats. Assuming an attacker wants to send message to patient that passes VeriSMS in every way. First and foremost, the attacker should spoof the hospital's phone number when sending. Further, the attacker should obtain the user's chosen secret word combination. And finally, to pass the voice agent, attacker needs to obtain a message ID previously has been sent by the hospital. The success rate would be low for code guessing attacks. With assumption that message ID has 5 digits and a pool of 4,000 secret words available for user to choose, the success rate for attacker guesses everything correctly is 1.6 times 10 to the negative 12. Even if user choose to not call, the rate is still as low as 1.6 times 10 to the negative 7, thanks to the word combination design. Another aspect we need to consider, though we believe it's hard, is that attacker may find a way to spoof user's phone number and call voice agent to extract secret words. However, the attacker would still need to guess a 5-digit message ID correctly in limited attempts. The success rate would be as low as 1 times 10 to the negative 5. To summarize, VeriSMS by its design largely mitigates the phishing threats of SMS patient outreach and significantly raises the barrier of successful spoofing the hospital. With a sounding design of VeriSMS in theory, we further evaluate its performance with real users through user study. We organize our user study in form of one-on-one interview sessions. One typical session first starts with an interactive tutorial where the participant receives a printed tutorial about VeriSMS as well as a hospital card with phone number. During the tutorial, they set up with VeriSMS and are free to make calls to the voice agent and free to ask any question about VeriSMS. When the participant confirmed they understood how VeriSMS works, the participant will receive a series of text messages on their phone, and they shall tell the interviewer whether they classify each of the message received as fraud or benign message. The interviewer do not provide any additional help or answer any question during the attack simulation. With all messages are classified by the participant, interviewer finally asks them questions about using VeriSMS and let them complete a standard system usability scale survey. We designed the user study with priming effect in mind. We invite participants to attend a second session after at least 7 days, and there is no interactive tutorial in phase 2. The 7-day gap of not interacting VeriSMS allows memory to fade in certain degree. We recruited 35 participants in total, and 9 of the 35 participants attended phase 2 of the study. Considering our targeted audience, we also intentionally recruited more elderly participants. 43% of the 35 participants are at least 55 years old. Now, we further explain how we design our attack simulation. During the attack simulation of each session, participants will receive a total of 7 messages in random order. 4 of them are benign messages, which will have correct message ID and the correct secret word combination they chose. 2 of 7 messages are called fraud A. They have the same format but with wrong message ID and secret words. These messages simulate a code guessing attack. One additional message is a plain text message without any security features and is to simulate an omission attack. Since we are interested in the performance of VeriSMS, we tried to rule out the influence from the text content. We used one unified content pool for all 7 messages. All the messages are collected from our healthcare partner OSF, and they are all real-world content. All messages in the pool contain a link placeholder, so participants will not be affected by different links or if there's a link or not. All messages are randomly selected at runtime, so there's never a fixed combination between content and the type of the message. Without further ado, let's look at detection performance of VeriSMS in the user study. It is an encouraging result that all 35 participants, including all elderly participants, correctly identified every fraud message. It means they learned how to use VeriSMS for detection. For the benign messages, on the other hand, though not as perfect, we still have the majority of them correctly identified all benign message as benign. With the fully correct fraud detection performance during both phases together with the close 83 versus 77 benign detection performance, we observe here is no significant performance declination for phase 2. It is also worth noting that the elderly participants is only slightly underperformed comparing to the overall results, and this alleviates the concern that elderly participants may not interpret VeriSMS as well. And the result tells us they comprehend how VeriSMS works. We use standard system usability scale survey to measure the usability of VeriSMS. With a mean of 79.1, we conclude that based on the standard interpretation, VeriSMS have a good usability and is even close to excellent. In addition, mean usability score is not significantly dropped in phase 2, meaning that with the 7-day gap, participants still find VeriSMS easy to use without a tutorial. To our surprise, the main usability score for the elderly participants only is higher than overall. This is promising, as serving elderly is one of our main emphasis. We also further investigated that we have one same participant in both phases give a low usability score. During the exit interview, this participant told interviewer they do not want patient outreach over text message at all, and they prefer to use mobile apps. This means this participant is not our target audience of VeriSMS and should not be seen as a flaw of VeriSMS itself. In addition to all quantitative results, we also coded and analyzed participants' responses from exit interview, and this allows us to better interpret the root cause of false positives and assess our design choices. Before the user study, we quickly realized that all users' input should be read back, including the numbers and choices during our pilot user study. This eliminates most confusions of using voice agent. However, we still observed one case during the user study that participant misread message ID before even making that call to voice agent, and readback didn't correct that mistake. Other than this occasion, most false positives are because of participants' belief message content is suspicious, even if they are authentic content from OSF Healthcare. We also asked participants when will they choose to call the voice agent. The result confirms our assumption that one-time code will never work because over 74% participants will choose to not always call to verify messages. In conclusion, we believe VeriSMS is effectively mitigating the phishing threats for SMS patient outreach, and the user study confirms its usability. The most important lesson we learned is that usability is just as important as security, and user habits should be considered when designing the system. We do acknowledge that we need to explore more adaptive attacks and work with OSF to explore options to deploy VeriSMS, which could potentially give us more insights on further refinement of its design. That's all I have today. Thank you for listening. It will be my pleasure if you would check out our full paper.